Welcome back. You know, the Greek word for apnea means without breath. So sleep apnea is an involuntary stopping of breathing, sometimes hundreds of times during the night. You might not know that more women experience sleep apnea than men, and that's what Dr. Michael Bezbatchenko and Dr. David Ralston are here to talk to us about. Good morning, doctors.
Good morning. Good morning.
It's good to have us here. So first question, define for the viewers that don't know, what is sleep apnea?
Sleep apnea is when you stop breathing while you're sleeping for really more than about 10 seconds at a time.
What are some of the symptoms, doctor, of sleep apnea?
Well, they can be a myriad, a whole bunch of them. Anything from problems with memory, lack of energy during the day, fatigue, just not feeling rested when you wake up in the morning ready to go.
Who does, we were talking earlier, between the men and women, who does sleep apnea affect more, even to the general public's eye, but maybe people don't know about?
Well, men are actually more affected, but the women are not far behind, and very often they're not diagnosed enough because they don't have the symptoms. Like the big snoring symptom is the men. Women don't tend to snore as much.
What are some of the symptoms that you need to look for in women versus men when trying to diagnose sleep apnea?
Well, women in general, like I say, snoring is unfortunately not a feminine trait. So a lot of times women don't report snoring to their family physicians or a sleep specialist. A lot of times women just have no energy, lack of get up and go sometimes. So they go to the family doctor, and a lot of times say, well, the doctor will say, well, gosh, you have lack of energy, fatigue, you might be depressed. And so they'll just try antidepressant medicines, which unfortunately the problem is the sleep, not depression.
So when someone comes into your office, what are some of the sure signs that even husbands or wives can look for if their spouse is suffering from it? What are the things that they need to notice throughout the night?
Well, one of the things I think is really important is to actually witness whether they're holding their breath or not. The person who's sleeping doesn't know that they're they're holding their breath, but the partner can tell that.
I've had that happen with my wife sometimes. But Katie will tell you, sometimes if I'm in a really deep nap, she'll see me go, but not a couple times, so that's something we've looked into. Are there any other symptoms, doctor, that people can look for?
Well, a lot of times there's cardiovascular risks involved as well, too. A lot of times people with sleep apnea will have problems with hypertension, strokes, and heart attacks. So a lot of times, a lot of cardiologists will send me their patients for concern over sleep apnea as the root cause of hypertension and all the cardiovascular risks with sleep apnea.
From a dental standpoint, because I'm a dentist, people tend to grind their teeth quite a bit.
TMJ, correct?
TMJ and just the wearing of the teeth. We dentists can really diagnose this much earlier than the physician sees somebody, because for 20 years, somebody's been flattening their teeth out.
Wow. So someone comes to you, possibly with TMJ. How does that transition work to work as a team to diagnose the sleep apnea?
We work together, and I evaluate the dental part of it, and if I see those signs and symptoms, then I send them to Dave here, and then we have to be diagnosed with a sleep test in the evening to be able to identify whether you have obstructive sleep apnea. So we work together to kind of find the common ground here.
What are some of the effects down the road if someone goes undiagnosed and doesn't treat it and doesn't take care of it?
Well, as I mentioned, some of the cardiovascular risks are the concern, the high blood pressure, risk for strokes, heart attacks, and more importantly, quality of life is one of the most important things that we worry about, because it's not fun to come home in the evening, fall asleep watching television, no energy, weekends are shot just resting and trying to recover, and it's a vicious cycle you get into at that point.
I had one patient who basically was falling asleep at the traffic light. What? It can get you that quickly because you're so excessively tired during the day.
Just in an instant, just like that.
So a lot of car accidents are really related to sleep apnea, more than you'd ever think.
I've heard some of the stories and seen photos when you're trying to treat sleep apnea. There's a lot of tubes and things that you have to hook on while you're asleep. You guys go a different route, though. You have a different approach, though, don't you?
Sure. There are several treatment options available for sleep apnea. One is the CPAP, everybody knows this, the mask. Yeah. And it works effectively. The problem is comfort. A lot of people cannot tolerate it. There's comfort issues involved. What has made advances over the past few years is use of an oral appliance or dental device. And that's where he gets involved.
That's where I come in, 'cause
tag team.
From a dental standpoint, I mean, the gold standard is the CPAP, but a lot of people just can't tolerate that, so they can wear a dental appliance. It basically just kind of helps to hold your jaw open so that you can get air during the middle of the night, and it cuts down the snoring too.
Great. Well, if you're suffering from it, make sure you see these doctors right here. Thank you so much for joining us today. It was a pleasure to have you on Marketplace.